For some time now, the Obama administration has been saying that Healthcare.gov, the federal Obamacare exchange website, will be fully functional by November 30. A circumflex 2 months after it was first opened to the public and promptly crashed. However, according to Centers for Medicare and Medicaid Services, CMS, Deputy Chief Information Officer Henry Chow, as much as 40% of the website's supporting systems remain in development, suggesting that such administration pronouncements are exceedingly optimistic. A circumflex is not that is not working. A circumflex, Chow told a subcommittee of the House Energy and Commerce Committee Tuesday. A circumflex is still being developed and tested. A circumflex, Chow testified that the consumer interface is complete. A circumflex, the online application, verification, documentation, plan compare, generating enrollment, thought is 100%. A circumflex, but that part of the website is most definitely not working, as Health and Human Services Secretary Kathleen Sebelius discovered when the site crashed before her eyes during a Tuesday appearance in Miami, Florida. Grilled by Republican Cory Gardner, R. Colo, as to how much of the rest of the software still needs to be built, Chow estimated a circumflex 30 to 40%. A circumflex, what is left, he said, are a circumflex the back-office systems, the accounting systems, the payment systems. A circumflex, we still need to build the payments system to make the payments to insurance companies. In January, a circumflex, he explained. Chow's estimate is a circumflex an astounding percentage. A circumflex, observed for Bessa Avik-Roy. A circumflex apparently, the accounting systems and payment systems that protect taxpayers against waste, fraud, and abuse. A circumflex systems that also ensure that insurers get paid, and that premium subsidies are accurately doled out. A circumflex have not yet been built. A circumflex, this also casts doubt on the administration's claims of hundreds of thousands of Obamacare enrollees since a circumflex technically, you have not enrolled in a health insurance policy until the insurer has collected the first premium from the beneficiary. A circumflex, Roy averred. According to CNBC, shortly after Chow's testimony, CMS spokeswoman Julie Battelle a circumflex revealed some good news for Healthcare.gov, saying insurers and online insurance marketplaces will very soon be able to directly start enrolling people in Obamacare insurance who qualify for government subsidies to offset its cost. A circumflex, but a circumflex did not give an exact date by which the site's insurer payments tool would be up and running. A circumflex, saying, a circumflex is something we do not need online until the middle of January. A circumflex, however, a circumflex, noted CNBC, a circumflex for people insurance to kick in by Jan. 1, they need to make payments for their Obamacare insurance policies by Dec. 15. A circumflex. Chow's testimony and Battelle's subsequent remarks did little to soothe the jangled nerves of insurers, who are already reeling from Healthcare.gov's technical difficulties, not to mention all the new rules and regulations emanating from Washington. A circumflex has not a lot of confidence that the reconciliation process is going to be up and running in time, and given all the challenges that we are facing with the enrollment files, thought as a big cause of concern. A circumflex, an insurance industry source told Politico. A circumflex, if people are enrolling, but the back-end systems are not working, their coverage could ultimately be disrupted. They may think they are re-enrolled in a plan and they are not. They may show up at the doctor's office and not be covered. A circumflex. In another sign of the chaos at CMS, Chow testified that he had never seen the March report by private consultants that a circumflex foreshadowed many of the problems that have dogged Healthcare.gov since its rollout. A circumflex, in the words of the Washington Post, which recently obtained a copy of the report from the Energy and Commerce Committee. A circumflex, I was aware some document was being prepared. A circumflex, Chow told the House panel, but he insisted he had no knowledge of the document's contents until they appeared in the news media. This was not the first time Chow, Described by Politico as a Circumflex, a key player in the Obamacare website's creation, a Circumflex had allegedly been kept in the dark in regard to major concerns about the site. On November 1, he told the House Oversight Committee that he had not been apprised of the contents of a report detailing a Circumflex high risks to the website's security. A Circumflex, the concealment misled Chow to believe that there were no longer any high security risks to the launch of the federal exchange, prompting him to recommend the approval of Healthcare.gov. A Circumflex, Roy wrote. Despite this, Chow said Tuesday that he believes that the website is secure, claiming that no hacker attacks have occurred. A Circumflex, to our knowledge. A Circumflex security experts who testified before the House Science, Space, and Technology Committee later that day were considerably less confident. A Circumflex hackers are definitely after it, a Circumflex, said David Kennedy, CEO of information security firm TrustedSec. A Circumflex, and if had to guess, based on what I can see, I would say the website is either hacked already or will be soon. A Circumflex,